And Dr. Jha, what about Dr. Cuomo's recommendation? If you've been at large protests or a protest, you should now get tested.
Yes, so good evening, Lawrence, and thanks for having me on. So I agree with that. Obviously, we're worried, all of us are, that the protests are going to fuel new infections. And one of the best things people can do beyond wearing masks and using hand sanitizers and trying to stay in small groups is getting tested before and after the protests.
Now, what would you say to someone like Mitt Romney, who's in his 70s? He's a man of obviously great physical health, and I'm not even going to say for a man of his age, for it looks like a man of 35. And he decided yesterday he wants to go out to that march in Washington. He put on a mask. He went out to that march. What would you say to him before that? Would you recommend against him doing that?
You know, these are complicated decisions, Lawrence. People are choosing between things that obviously increase their risk a little or a lot, depending on how you behave, but definitely increase the risk. Again, speaking up for injustice, and that is also a long-standing tradition in our country. So if I were his physician, I would say to him, if this is something you feel strongly about, wear the mask, try to stay distant from other folks, use hand sanitizers and keep your hands clean, and don't spend too much time out there. You know, don't do this for days, especially for someone like him who is at higher risk.
And where do you see us tonight? Where do you see the United States tonight in our curve of this pandemic?
Yeah, you know, this is a difficult one, right? Because we really have a tale of a couple of different countries in one. The places that were the hardest hit, New York, New Jersey, Connecticut, continue to make really good progress. Cases declining substantially. But as you said in your introduction just before this segment, we do have large chunks of the country, the Arizona, North Carolina, Florida, other places, California, where cases are rising. And that really worries me because as we continue into the summer months, and especially as we look out into the fall, we have a lot of cases of this disease, and in many places it's heading in the wrong direction.
As we go forward, what is your recommendation on testing? Are we at the point where everyone who can be tested should get tested, or should we still be more concerned with people who have symptoms and wait, and those of us who don't have symptoms just waiting? Is there a moment where we should all just get tested?
Yeah, so this has, of course, been the incredible frustration of this entire response, is the failure of the federal government to get this going. We're up to about 400,000 tests a day. That's good. That's progress from where we were a couple of months ago, but far from where we need to be. And so what I'd like to get to is a point in the country where everybody with even the mildest symptoms is getting tested. Their contacts are getting tested. High-risk places like nursing homes, hospitals, meatpacking plants, et cetera, are getting tested. And we still should have tests left over for schools and colleges when they open up. We are nowhere near that. And I am not convinced that our federal government is going to get us there.